DEN121 Dental Hygiene Preclinic Lab Test, Post-Treatment Operatory Disinfection, Infection Control. You have just completed treatment and dismissed a patient. Demonstrate operatory cleaning disinfection. Don gown, if not already wearing, mask, and face shield or glasses.
I am already wearing my prescription lenses, so I am just going to put on my overglasses.
Wash or sanitize hands and don treatment gloves, then nitriles. Remember, nitriles should be disinfected from the previous patient.
Want to make sure your gloves cover your cuff before you go into your nitriles.
Open lower cabinet door under sink and retrieve instrument transport box. Open box and place on counter. Remove 7 disinfectant towels and place in groups of 2, 2, 1, 1, 1 on the chase. They may overlap, but you should be able to pick up one group of towelettes without contaminating the other groups. Use a paper towel as a barrier to remove plastic covers from computer keyboard and mouse. Use paper towel to push in writing desk. Discard paper towel.
I'm going to discard the wax paper that I was using. And then I'm going to push in the desk. Discard the paper towel.
Move clean keyboard to top drawer and mouse to charger or drawer.
This particular mouse is a battery operated mouse, so it doesn't need to go on a charger. So you're just going to make sure you turn this off before you put it in the drawer.
With clean nitriles, remove unit water bottle, empty remaining water into sink, replace water bottle on chair unit.
Remember, lefty, loosey, righty, tighty.
Remove name tag and place on countertop. Remember, nitriles should still be disinfected at this point. Once name tag is touched, nitriles become dirty. Express both air-water syringes on the unit, operator and assistant side, into a cup or the sink. You may remove tips at this point.
I'm just going to make sure I express all of the water out of the air-water syringe tip. I'm going to take the tip off at this point. I'm going to purge the assistant side also.
Purge supplemental equipment, ultrasonic, Profijet, etc., if used, into a cup or sink until all water is drained by removing the instrument tip insert. Place tips in transport box. Lines should not have water left in them.
You want to make sure when you're purging your supplemental equipment, there's numbers 1 through 6 with the little arrow. You want to make sure you turn it all the way up. Want to get your foot pedal over. Move this over. And you can certainly do this in a cup. You just have to remember to get your cup out without contaminating. And you're going to purge the lines. And I'm going to remove the insert. And place it in my box.
Remove bioburden, blood, plaque, calculus, with a gauze carefully from instruments.
While you're working on patients, you will actually be using gauze to wipe off your instrument. Bioburden can be blood, plaque, calculus, sometimes it can be glue, sometimes it can be a variety of things, big chunks of things. So you'll just wipe off very carefully. You're just wiping this off very carefully. If you notice some instruments that have bioburden still remaining, you just want to make sure you wipe those off very carefully.
Place instruments, handpiece, and ultrasonic tips sheath in transport box and take to sterilization room. Place all on dirty side counter for sterilization person. Bring dirty box back to operatory and place on counter along with other dirty items for disinfection.
So I closed up my instruments, locked them, placed them in the box. I am also going to take my handpiece. This is what I used when I was polishing my patient. I've already taken my supplemental equipment tip and sheath and placed it in the box. I'm going to close the box up. I'm going to transport this to sterilization and place on the dirty side. Now I'm going to bring the box back to my operatory so that it can be disinfected.
Place the patient mirror, patient safety glasses, napkin chain, and any other items that are contaminated in one area of the counter with the name tag. Pens and pencils will go in this pile if contaminated. Remove all barriers and disposables, air water syringe, light handles, saliva ejector, high-speed suction, pens, pencils, operator chair adjustment levers, and place in the patient chair bag.
So I'm just removing all the barriers. You want to make sure that when you use sticky barriers, that you fold down the edges so they're easier to get off. going to look around and make sure haven't left any barriers. And I haven't.
Carefully remove barrier bag from bracket tray and place in patient chair cover. Carefully remove barrier bag from supplemental equipment assistant side and place in patient chair barrier. Without contaminating patient chair, roll up the chair barrier with contaminated barriers and disposables and place in bay trash container. Clean by removing bioburden. Using 2 towelettes, one in each utility gloved hand, wipe the chair arms, top and bottom. Always keep a towelette between the nitrile glove and the item being cleaned and disinfect to prevent recontaminating the item.
So I'm going to use the towelette, chair arms,
Pull out and wipe writing surface.
I'm going to pull out the writing surface, and we actually make sure you wipe the edge really well. That's where it mostly gets dirty.
Thoroughly wipe the soap dispenser bar. Wipe the countertop. Using a wipe in each hand, pick up and clean the items on the top of the counter, including the instrument box and lid.
Okay, so I'm going to wipe the counter. I'm going to kind of scooch everything down. So that I can make a clean spot.
Place the newly cleaned items on a newly cleaned area of the counter. Wipe any other items you may have inadvertently contaminated during treatment. For example, drawer handles, view box, unit arms.
So I'm going to wipe the box. And this is hard with your nitriles on, so place it in a cleaned area. Notice how I'm wiping everything and then placing it back in an area that I've cleaned already on the counter. And this will be anything that you have on your counter.
Wipe all items that had sleeve barriers. All must be complete to be counted. Light cover, light handles, and the switch.
Okay, light cover, light handles. And I often see, even with the barriers, I see students grabbing with their nitrils and overextending the grab barriers. So we just want to make sure we wipe everything. Only you know what you've touched that may be contaminated. Light handles and switch.
Both air water syringe housing and hose.
Air water syringe. The hose. And the housing where it sits on the bracketry. Want to make sure you do the assistant side also if you use it. And the housing.
Handpiece housing and hose.
Handpiece hose. Handpiece housing.
Saliva ejector housing, hose, high-speed suction housing and hose.
Saliva ejector. Housing. And then high speed, if you use it, you may not use this on every patient, but if you do, or even if you don't use it and you accidentally contaminate it with your gloves, you want to make sure that you're wiping that. These are all kind of close together right here. And housing.
Ultrasonic, hose and shelf.
Ultrasonic hose. And the shelf. And if I accidentally touch the ultrasonic, I would wipe it, especially if I had to adjust my settings. You want to make sure you wipe it. And the housing.
Operator chair adjustment levers and any other parts of the chair you may have touched.
Adjustment levers. And this is if you needed to adjust your chair while you're working on your patient. I often see students push their chair around with their hands instead of their feet. So if you push your chair with your dirty gloves on, you would want to make sure that you wipe the areas that you touched. Only you know what you've touched and contaminated.
Wipe anything else you may have inadvertently touched with dirty nitrils. Discard wipes. Wash the nitrile gloves with soap for 15 seconds using the same procedure as hand washing. Dry gloves with paper towels. While still wearing the nitrile gloves, disinfect thoroughly with a single towelette.
We're going to wash our, make sure we're getting on the getting in between the fingers. One of the reasons I'm going to dry the nitrile gloves before I use the towelettes The nitrile gloves must be dry so as not to dilute the disinfectant. So it may take you several paper towels to get this dry. I'm going to take one of the towelettes.
These must remain wet for 3 minutes before continuing with the disinfection process.
So for 3 minutes, I'm going to stand here. You can count in your head. If you need to, you can count out loud. You can watch the clock. Three minutes is a really long time when you're waiting. Thirty more seconds. Okay.
This concludes the cleaning portion. After nitriles have been disinfected for 3 minutes, using 2 towelettes, 1 in each hand, wipe the items that you previously cleaned in steps 16 through 19. All must be completed to be counted. Chair arms,
Chair arms,
soap dispenser,
soap dispenser,
counter, and all items on counter. Place the newly disinfected items on the newly disinfected portion of the counter and writing surface.
all right, let's keep everything down again. Make a clean spot. Disinfect my box, top. Trust me, this is as painful to do as it is for you to watch me do it. Clean a little bigger spot. Okay.
Writing surface.
Okay.
Dental light cover, light handles, and switch.
Light cover. Light handles. And any place else I may have inadvertently touched.
Both air water syringe housing and hose. Handpiece housing and hose. Saliva ejector hose and high-speed suction and housing and hose. Ultrasonic hose and shelf.
I'm going to go ahead and wrap this cord up just so hopefully it doesn't fall on the ground.
Operator chair adjustment levers.
And anywhere else you might have touched.
These items must remain moist for 3 minutes or for however long manufacturer instructions require. Discard towelettes. Remove operator overglasses.
Do that very carefully.
Wash with soap and water and then dry with paper towel. Disinfect glasses with a towelette and discard.
Want to make sure I get my glasses good and dry. Disinfect with a towelette. The soap and water was the cleaning portion. Now I'm disinfecting. And get it nice and moist so it can stay moist for 3 minutes.
Wash the nitrile gloves with soap and water for 15 seconds using the same procedure as hand washing. Dry gloves with paper towels. While still wearing the utility gloves, disinfect thoroughly with the last towelette. Clip over sink to dry.
Remember, I want to make sure they're really dry before I disinfect them. I'm going to use the last towelette. And since we're not waiting on these gloves to be disinfected, you can just get them really soaked with the towelette, and then you can hang them, and they should remain wet for 3 minutes, and then they'll just air dry. But I'm going to get it good and soaked up, good and moist. I'm going to do my little nitrile glove shimmy. Careful not to touch the outside. Flip them over my sink.
With treatment gloved hands, open the trash door. Push up the trash holder ring and hold with one hand while pulling the trash bag down with the other hand. Let the trash ring holder drop back in place. Remove the trash bag. Tie and knot. It's a good idea to compress the air out of the bag before placing it in the large yellow trash receptacle near the locker room.
So I'm at the yellow trash receptacle. Generally, this actually is kept back by the back classroom across from the bathrooms. But I brought it here just so we could show you what we're going to do when we walk all the way back there. I'm going to place the trash in the yellow trash can.
Remove treatment gloves and put in the can.
I'm going to remove my treatment gloves, and remember how we learned about doffing gloves.
Touching only ear loops or back band, grab mask and remove with one finger, throw in yellow trash can.
So I'm reaching behind my ear.
Holding from back only, remove gown, turning it inside out as you go, and deposit in yellow can. Use antiseptic hand rub on the way back to your operatory. Prepare operatory for end of day.
So now I've disinfected my hands. I'm ready to prepare my operatory for tomorrow.
Return writing surface to cabinet. Remove water bottle and place on counter upside down on a paper towel to drain.
Remember, lefty-loosey. I'm going to make sure I turn my operatory unit off. If you don't, your water bottle will continue to hiss at you.
Replace all large barriers. Patient chair barrier,
Chair barrier.
cover bracket tray,
I'm just going to go ahead and lay my next barrier there. There's a little knot in the bottom of the bag. You just want to make sure you kind of tuck that to the back of your tray.
cover supplemental equipment tray, assistant sidearm,
Make sure that little knot's out of the way.
barrierize light handles. If using sticky tape as a barrier, please fold down each side slightly for easier removal.
And I'm going to fold down each side. So it's easy to take off.
Light handles may also be covered with sandwich bags or aluminum foil.
And you will find that in your cabinet if you choose to cover with that.
Cover operator chair handles. Raise the dental chair, position the bracket tray over the chair seat, and position dental light over the bracket tray. Using your foot or barrier if using hands, push the rheostats onto the base of the dental chair.
So here are the rheostats on the floor. We want to make sure that we put those back on the base. And the reason we do this is when they come in at night, to mop and clean. We just want to make sure we have everything out of the way for them.
Place operator chair under the towel dispenser. Turn off the dental unit.
And I turned it off previously just because my water bottle was hissing.
Replace the trash bag.
Just bring it up through the middle and then just tuck it under the ring. It'll drop back down and then you just straighten it out.
At this time, you may put away items on the countertop if it has been 3 minutes.
And it has been 3 minutes, so I'm just going to put the box back under the cabinet. And you can put away any of the things that you've left on the counter.
Clean loops or prescription eyewear with wet microfiber or cotton cloth according to manufacturer directions. Place on disinfected counter or back on your face if they are prescription eyewear.
So my prescription eyewear, I would actually use a microfiber to clean them. I don't have that with me, but I would clean it and then put it back on my face to wear.